Pleasant day, everyone. For our nursing research lecture today, this video is outlined in three major parts. We have frameworks, variables, and hypotheses. In the succeeding slides, I just included here the different terms that you might encounter. So please be familiarized with them, and I'll just go through them very quickly since the details are pretty straightforward and they will be elaborated as we go along with our discussion. First, when we say study, we also call it as investigation or research project. Commonly, when we use the term and you're asked, what is your study all about? That means you are questioned about your research topic or problem identified in your research. Then we have here the different roles in research. We already discussed this in our first lesson. Ang bago rito would be the term consultants. And when you play a role as a consultant of a research, that means that you have a specialized expertise that can contribute significantly in completing the study. Usually, short-term basis yung engagement niya. And once, for example, na-address niya na yung kailangan niyang gawin, then he or she may exit na. And then you have funder or sponsor. This is someone who can assist or pay for the research costs. Like if your research is funded by an organization or a group. Next, we have the term reviewers, are the ones who check and give suggestion to improve our study. Peer reviewers, if the ones being evaluated are their colleagues or both parties are professionals. Mentors, they also serve as reviewers, such as in our case, you as our students, and we as your mentors, advisors, or panelists. Next is site. It is different from setting. Site is the overall location, for example, in your school or in your barangay, and it can be more than one, which is called as multi-site. Setting, on the other hand, is more specific place where you will be collecting your data to your respondents or participants. Now, natural settings like an office or home or in the field is common in qualitative research where natural environment is used. Laboratory, common in experimental research naman, either non-human or human study. And then you have quasi-natural settings, are places not necessarily natural to your respondents, like patients in the hospital. Concepts, theory, bias, and randomness. These terms will be discussed further later. I just included here in the first part that is for your quick reference lang. So that pwede nyo silang balikan very quickly since nasa una sila na PowerPoint slides. Next, since quanti and quali are two different research categories or approaches, some terms are not necessarily applicable to the other, though we use them oftentimes. So, for example, when we refer to people being studied, person contributing information, which is known as sample. So kapag ka sinabing sample for quantitative, we use the terms subject to refer to people acted upon by the researcher or respondent who answer your research instruments. So pwede natin gamitin yan for quanti, subject or respondent. Now, for qualitative research, we use the word informant or study participant since they are the people cooperating in your study. Remember, we do not use the term subject or respondent to refer to our sample in qualitative research. So it is suitable to use informants or participants. So you have to be careful lang in addressing your sample. Kung quanti or quali ba yung research na ginawa ninyo. So again, kung quanti yan, you refer to your sample as respondents or subjects. Pero kung qualitative naman, then you refer to them as your participants or informants. Next, person undertaking study. For quantitative research, we can refer to them as researcher, investigator, and scientist, especially in experimental research. Ngayon, kung qualitative naman ang pag-uusapan natin, we refer to the researchers or to the person undertaking study as researcher and investigator only. Okay? So, yung scientist, ginagamit lang natin siya for quantitative research, specifically sa mga experimental research design. In this table, we have phenomena, concepts, and constructs to refer to what is being investigated. Again, phenomena, concepts, and constructs to refer to what is being investigated. Kung ano ba yung pinag-uusapan or pinag-aaralan mo under your research. Now, we all know that research involves at abstractions. For example, an example would be pain, quality of life, and resilience. So they are all abstractions of a particular aspect of human behavior and characteristics. These abstractions or mental representations are called concepts in quantitative studies. While for qualitative studies, we use the term phenomena. Okay? Now, researchers also use the term construct, which is like concept, and a construct is an abstraction inferred from situations or behaviors. Now, according to Kerlinger and Lee of 2000, so they distinguish concepts from constructs by noting that constructs are abstractions that are deliberately and systematically invented or constructed by researchers. For example, self-care in Orem's model of health maintenance is a construct. So the terms construct and concept are sometimes used interchangeably, but by convention, a construct refers to a more complex abstraction than a concept. Okay? So, mas complex yung term na construct when we compare it to concept. Nonetheless, si concept at saka si construct, commonly ginagamit natin siya sa quantitative research. And then for qualitative, we use the term phenomena. And then, kanina sabi natin, ay by the way, yung concepts na yan and then construct, they will be elaborated pa later in our discussion. We have a separate discussion on that. And then kanina sabi natin that a theory is a systematic, abstract explanation of some aspect of reality. So that is our definition of theory, right? So theory knit concepts together into a coherent system and plays a significant role in both qualitative and quantitative research. So ito yung mga pinagtagni-tagni nating mga abstractions or concepts to create one single system, information, or idea. So um, that is a theory. Now, quantitative researchers may start with a theory, framework, or conceptual model. So based on theory, they make predictions about how phenomena will behave in the real world if the theory is true. Specific predictions deduced from theory are tested through research. So tinetest natin yung mga predictions ng theory in our research. The results of which are used to either support or modify the theory. Now, theories na commonly used na by researchers, examples like Nightingale's environment theory and Benner's novice to expert, among others. So this is just an overview of the theory and these other terms since mamaya mas madidiscuss natin ito comprehensively. So now, in qualitative research, we use conceptual or sensitizing frameworks which provide an impetus for a study or offer an orienting worldview. In such studies, the framework helps to guide the inquiry and to interpret gathered information. Sa ibang qualitative studies, since we have different designs in qualitative research, theory is the product of the research. So yung nabuong theory, yun yung pinaka-output ng research. So the investigators use information from participants inductively to develop a theory rooted in the participants' experiences. So the goal is to develop a theory that explains phenomena as they exist, not as they are preconceived. So we call that qualitative design as grounded theory. Okay? So ito lang yung terms na ginagamit natin when we refer to systems of organizing concept. For quanti, ito yon theory, framework, and conceptual model. And for qualitative, sensitizing or conceptual frameworks. Then, when it comes to data, we all know that for quantitative, we use quantitative data in numeric form or in numbers. While for qualitative data, we use words and narratives obtained from our interview to the participants. So when we say relationship, which is a bond or connection between phenomena or concepts, so for quantitative, it is our major concern, such as the relationship between IV, independent variable, and DV, which is a dependent variable. So we would want to know if relationship exists, the direction of relationship or nature of relationship. Now, while in qualitative research naman, we don't quantify relationship, no? So, hindi iyon yung concern ng qualitative study. And then, still under relationship among variables for quanti, we have two types. The cause and effect relationship or the causal relationship. And then you have functional relationship. So, ito, again, we have a separate discussion for this later. Okay, so for the first part of our discussion, so yung mga terms na yun, that is just those are the terms to remember lang. So I included them sa mga unang slides so that you can go back to those terms very quickly. So for the part 1, we are going to talk about theoretical and conceptual frameworks. So marami tayong terms na ginagamit in connection with conceptual context for research. We have theories, models, frameworks, schemes, and maps, among other terms pa. Now, disclaimer lang before we start. Please take note that research book authors offer guidance in distinguishing these terms. But note that the definitions are far from universal. Ibig sabihin, wala tayong absolute definition for them or definitions may vary, eka nga. So indeed, a confusing aspect of theory-related writing is that there is no consensus about terminology. Pero sabi ko nga, this discussion will guide us so that we will be on the same page when we talk about the said terms. Okay, first, let's talk about the concept of concept. So what is concept? So when we define concept, it is an abstract term derived from particular attributes from Kerlinger of 1986. According to Kim, it is a symbolic statement describing a phenomenon or a class of phenomena. Concepts may be abstract, for example, hope, love, or desire, meaning we cannot see or observe them. And concepts may be relatively concrete or concrete, no? Examples of concrete concepts are airplane, body temperature, or pain, which are directly observable and measurable. So concepts are formulated in words that enable people to communicate their meanings about realities in the world. So further, a concept may be a word, meaning single word lang like grief, empathy, power. It can be two words, for example, job satisfaction, need fulfillment, role strain. Or it can be a phrase, for example, maternal role attachment, biomarkers of preterm labor, health promoting behaviors. And then finally, remember this. When concepts are operationalized, they become variables used in hypotheses to be tested in research. So basically, your concepts are also your variables in quantitative research since we measure them. Scholars and researchers define concepts clearly and distinctly so that their readers may thoroughly and accurately comprehend their work. Because conceptual meanings are dynamic, they should be defined for each specific use the writer or researcher makes of the term. So in your case, sa research nyo, make sure to define your terms clear and concise. So that is the definition of concept. Now, what are the different types of concept? In nursing literature, concepts have been categorized in several ways. For example, they have been described as concrete or abstract, variable or non-variable, and as operationally or theoretically defined. Now let's discuss each. First, we have abstract versus concrete concepts. So concepts may be viewed on a continuum from concrete, that is specific, to abstract, which is general. So when we say concrete concepts, which have simple, directly observable empirical reference that can be seen, felt, or heard. Example, a chair, the color red, or jazz music. So concrete concepts are limited by time and space and are observable in reality. So anything na we can sense or observe, that is concrete concept. Now, on the other hand, abstract concepts, examples are art, social support, personality, or role. So these are not clearly observable directly or indirectly and must be defined in terms of observable concepts. Abstract concepts are independent of time and space. The more abstract a concept is, the more it transcends time and geography. So it is the opposite of concrete. Okay. So next we have theoretically versus operationally defined concepts. Theoretical definition gives meaning to a term in context of a theory and permits any reader to assess the validity of the definition. An example of concept is self-esteem. So theoretical definition of self-esteem, for example, is a person's sense of self-worth or value. Again, ang basis natin dito ay mga theories. While operational definition tells how the concept is linked to concrete situations and describes a set of procedures that will be performed to assign a value for the concept. So operational definitions permit the concept to be measured and allow hypotheses to be tested. Thus, operational definitions form the bridge between the theory and the empirical world. Example, yung sa kanina nating self-esteem. So, for its operational definition, ang pwede natin dong makuha is the score on the Rosenberg Self-Esteem Scale. So, name-measure natin yung mga operational definition using a tool or instrument. Okay? So, dapat congruent din yung ating theoretical definition and operational definition. Kung meron kang um, definition under theoretical, tapos sometimes dapat meron kang operational definition din, if possible. No? Kung kayang ma-measure yung concept na yon, then you should have an operational definition for that term. Okay, and then in this table, I provided here several examples of theoretically and operationally defined concepts. So please be guided since in writing your research paper, you have this section as well. So commonly, theoretical definition also connotes conceptual definition. For example, the concept or term spiritual care. So its theoretical definition is the frequency of assessment and interventions related to spiritual practice and barriers to providing spiritual care. So anchored siya sa theory. Oftentimes sinalagay natin yung pinanggalingan ng idea or we have citation. Naglalagay tayo ng ating reference. Now, to measure the spiritual care, we can use the score on the spiritual care of practice questionnaire. So that is how it will be operationalized. As a researcher, it is your responsibility to again make clear of your concepts by providing conceptual or theoretical definitions and outlining how they will be operationalized or measured in your study. Next section, still under concept. Shortly lang, let's talk about sources of concepts. So the first source, we have naturalistic concepts. So they are concepts seen in nature or in nursing practice such as body weight, thermoregulation, hematologic complications, depression, pain, and spirituality. So this may be on a continuum from concrete to abstract, and some may be measurable. In fact, for example, body weight and height, or body weight and temperature, and others like pain or spirituality, measurable only indirectly and only in principle. Secondary source of concept, we have research-based concepts. So they are the result of conceptual development that is grounded in research process. So ito yung mga concepts na na-generate natin because of conducting research. Examples include helping seeking behavior, care transitions, compassion fatigue by Jenkins and Warren of 2012, and shared presence. So we have those concepts now because they are the products of researches. Okay, so yun yung mga references natin kung sino yung mga develop ng concepts na yan through their research. Last source, we have existing concepts. So, di ba kanina you have naturalistic concepts, next you have research-based concepts, and then finally, existing concepts. So, nursing literature is filled with adapted concepts, more or less well synthesized through derivation from other disciplines. Such concepts include human needs from Maslow's hierarchy of needs and stress from Selye's physiologic theory of the stress of life. So theories of bodily function come from the study of physiology. So other existing concepts commonly used in nursing research, administration, and practice are empathy, suffering, abuse, hope, and burnout. So nagagamit din natin yung mga concepts na to, itong mga existing concepts, even if they are from other discipline. Now, this slide just showed the summary of the sources of concepts that we have just discussed. So, additional information na lang to. Okay, this is also an FYI. Earlier, we have defined already construct, right? Again, when we say construct, it is a highly abstract, complex phenomenon or concept, or I mean, highly abstract, complex phenomenon, and is denoted by a made up or constructed term. Okay, so construct is the term used to indicate a phenomenon that cannot be directly observed but must be inferred by certain concrete or less abstract indicators of the phenomenon. Examples of constructs are wellness, mental health, self esteem, and assertiveness. So each of these constructs can be identified only through the presence of certain measurable concepts. Wellness, for example, it might be inferred through laboratory data or clinical observation. So the laboratory data would be a very objective indicator of wellness, whereas the clinical observation would be a less objective indicator of wellness. Okay, so as indicated kanina, marami tayong terms talaga in research and oftentimes these terms overlap or used interchangeably. So that is construct. Now that you know what a concept is, we can now talk about theory. So in high quality research, a clear, defensible conceptualization is made explicit. For example, in an experimental research, suppose we hypothesize that a smoking cessation intervention would reduce rates of smoking among patients with cardiovascular disease. So the question that follows is, why would we make this prediction? That is, what is our theory or our theoretical rationale about how the intervention might bring about behavior change? Do we predict that the intervention will change patients' knowledge, attitudes, motivation, or sense of control over their decision making? Or our view of how intervention would work should guide the design of the intervention of the study. Okay, now, that is an experimental example. Another example this time, non-experimental naman. Suppose we hypothesize gender differences in coping with the loss of a child. So what is our theory for why men and women would differ? Do we suspect biological differences, role socialization differences, social expectation differences, or differences in social capital? So in both lay and scientific usage, the term theory connotes an abstraction. Okay, classically, we use theory to refer to an abstract generalization that offers a systematic explanation about how phenomena are interrelated. So pag sinabing theory, it has at least two concepts that are related in a manner that the theory intends to explain. Traditionally speaking, the purpose of theory is to explain or predict concepts. Another definition, theories are systematic explanations of events in which constructs and concepts are identified, relationships are proposed, and predictions are made to describe, explain, predict, or prescribe practice and research. So without nursing theory, nursing activities and interventions are guided by tradition, some outside authority, or hunches, or they may simply be random. So, hindi siya ganun ka accurate. Unlike the nursing theory or mga theories na meron tayo. Now, what are the components of a theory? First, we have concepts, which are the basic building blocks of a theory. So yung mga theory, they are made up of concepts. Yung na-discuss na natin kanina. Next, theories have relationships, which are denoted by terms such as is associated with or is contingent on. Ayan yung mga terms na makikita natin denoting the relationships among concepts or variables that is common in theories. And then classical theories comprise a set of propositions that indicate relationships among concepts. The propositions form a logically interrelated deductive system. This means that the theory provides a mechanism for logically deriving new statements from the original propositions. So we can make uh, inferences or hypotheses when we are guided by a theory. So yung tatlo na yon, those are the components of theory. So you have concepts, relationships, and propositions. Let us illustrate with the theory of planned behavior or TPB by Aj Sen of 2005. So TPB provides a framework for understanding people's behavior and its psychological determinants. A greatly simplified construction of the TPB consists of the following propositions. So ito yung mga propositions natin for TPB theory. That behavior is volitional. Behavior that is volitional is determined by people's intention to perform that behavior. Second, intention to perform or not perform a behavior is determined by three factors. Attitudes toward the behavior, for example, overall evaluation of performing the behavior. Subjective norms, example, perceived social pressure to perform or not perform the behavior. And perceived behavioral control, example, self-efficacy beliefs. The anticipated ease or difficulty of engaging in the behavior. And the third proposition, the relative importance of the three factors influencing intention varies across behaviors and situations. So given this information, we can say that the concepts of TPB, the building blocks of a theory, okay, that forms the basis of the TPB include behaviors, intentions, attitudes, subjective norms, and perceived self-control. Itong teorya na ito, which specifies the nature of the relationship among these concepts, provides a framework for generating hypotheses relating to health behaviors. So dahil alam na natin yung relationship between and among these concepts as stipulated in every theory, makaka-generate ka na din ng hypothesis or our propositions. For example, we might hypothesize on the basis of the TPB that compliance with a medical regimen, which is the behavior, could be enhanced by influencing people's attitudes toward compliance or pwede din by increasing their sense of control. So itong TPB theory has been used already in studying a wide range of health decision-making behaviors. For example, contraceptive choice, condom use, preventive health screening, as well as in developing health promoting interventions. So those are the concepts of a theory. So I mean the components of theory, no concepts, relationships, and propositions. So again, using the theory na we selected for our research study, we can hypothesize or we can create a hypothesis since iyon yung nagsisilbing guide natin. From theories, let's move on to models. Conceptual models, conceptual frameworks, or conceptual schemes. We use the terms interchangeably. So they are a less formal means of organizing phenomena than theories. So again, itong conceptual models, conceptual frameworks, or conceptual schemes, they are less formal of organizing phenomena than categories. Than theories. Now, like theories naman, conceptual models, it deals with abstractions or concepts that are assembled by virtue of their relevance to a common theme. So what is absent from conceptual model is the deductive system of propositions that assert and explain relationships among concepts. So wala tayong propositions in conceptual models unlike sa mga theories. So conceptual models provide a perspective regarding interrelated phenomena, but are more loosely structured and more abstract than theories. A conceptual model broadly presents an understanding of the phenomenon of interest and reflects the assumptions and philosophical views of the model's designer. And conceptual models can serve as springboards for generating hypotheses, but conceptual models are not formally tested. So the term model is often used in connection with symbolic representations of a conceptualization. And when we say schematic models or conceptual maps naman, are visual representations of some aspect of reality. So like conceptual models and theories, they use concepts as building blocks, but with the minimal use of words. So a visual or symbolic representation of a theory or a conceptual framework often helps to express abstract ideas in a concise and convenient form. Concepts and the linkages between them are represented through the use of boxes, arrows, or other symbols. Remember, kapag gagawa tayo ng schematic models or maps, make sure na maayos yung mga arrows and lines, hindi siya putol-putol at hindi magulo yung pagkaka-present natin. As an example, so this figure shows Pender's health promotion model, which is a model for explaining and predicting the health promotion component of lifestyle. So such schematic models can be useful in clarifying and succinctly communicating linkages among concepts. So yan yung ating schematic model example. From models, we now proceed to frameworks. So a framework is the overall conceptual underpinning of a study. Not every study is based on a formal theory or conceptual model, but every study has a framework that is a conceptual rationale. In a study based on a theory, the framework is theoretical framework. In a study that has its roots in a specified conceptual model, the framework is a conceptual framework. Although the terms conceptual framework and theoretical framework are frequently used interchangeably. So napagpapalit-palit din natin yung mga terms, yung paggamit sa kanila. In studies that fail to articulate a conceptual framework, it may be difficult to figure out what the researchers thought was going on. Sometimes researchers fail even to adequately describe key constructs at the conceptual level. The concepts in which researchers are interested are by definition abstractions of observable phenomena, and our worldview and views on nursing shape how those concepts are defined and operationalized. So remember, researchers should make clear the conceptual definition of their key variables, thereby providing information about the study's framework. So let's take this for an example. So the study is all about the extent of compliance of pulmonary tuberculosis patients to drug therapy. So it is theoretically anchored on Orem's theory with concepts self-care demand, nursing theory, self-care. So, ayan. So the theoretical framework of this topic is from Orem's theory. And based on Orem's nursing theory, self-care is considered as activities that people engage in to maintain, restore, or improve their health. So with that, we can infer here that if a person is sick, he or she will engage in self-care to restore or improve health. Having said that, the conceptual framework that we can come up aligned with a given study is this one. So the IV is drug therapy, and the dependent variable is the extent of compliance to treatment. So we are trying to figure out here that if a patient has a disease such as PTB, to what extent will he or she be compliant with his or her drug therapy to maintain or improve health? So this is an example of a theoretical framework and a conceptual framework, which is aligned sila pareho. Aligned sila pareho in the given study or topic. So in this section, we examine some general characteristics of theories and conceptual models. We use the term theory in broad sense, inclusive of conceptual models. So number one, origin of theories and models. So theories, conceptual frameworks, and models are not discovered. They are created and invented. Remember this again. See, theories, conceptual frameworks, at saka models, they are not discovered. They are created and invented. So theory building depends not only on facts and observable evidence, but also on the originator's ingenuity in pulling facts together and making sense of them. So theory construction is a creative and intellectual enterprise that can be undertaken by anyone who is insightful, has a firm grounding in existing evidence, and has the ability to knit together evidence into an intelligible pattern. So kayo, you can also create your own theory as long as you are creative, insightful, and grounded in existing evidence. At kaya nyong bigyan ng sense yung mga concepts na nakuha ninyo. Number two, tentative nature of theories and models. So theories and conceptual models cannot be proved. They represent a theory's best effort to describe and explain phenomena. So today's flourishing theory may be discredited or revised tomorrow. So this may happen if new evidence or observations undermine a previously accepted theory. Or a new theory might integrate new observations into an existing theory to yield a more parsimonious or accurate explanation of a phenomenon. So theories and models that are not congruent with a culture's values also may fall into disfavor over time. So for example, certain psychoanalytical and structural social theories, which had broad support for decades, have come to be challenged as a result of changing views about women's roles. So theories are deliberately invented by humans, and so they are not free from human values, which can change over time. Thus, theories and models are never considered final and verified. So we have no way of knowing the ultimate accuracy and utility of any theory, and so should treat all theories as tentative. Okay, remember that. Ano? So theories and models are never considered final and verified. So the relationship between theory and research is reciprocal and mutually beneficial. So theories and models are built inductively from observations, and an excellent source for those observations is prior research, including in-depth qualitative studies. Concepts and relationships that are validated through research become the foundation for theory development. So the theory in turn must be evaluated by testing deductions from it. Example, hypothesis. Thus, research plays a dual and continuing role in theory building and testing. So theory guides and generates ideas for research. Research assesses the worth of the theory and provides a foundation for new theories. So this slide shows an example of theory development. So this is how Jean Johnson developed her theory, self-regulation. So kindly read na lang thoroughly. It's already in the slide. This is just an additional information. So conceptual models and theories used in nursing research. So nurse researchers have used both nursing and non-nursing frameworks to provide a conceptual context for their studies. So these models constitute formal explanation of what nursing is and what the nursing process entails, according to the model developer's point of view. As Fawcett 2005 has noted, the four concepts are central to models of nursing include human beings, environment, health, and nursing. So, ang tawag natin dito, the meta-paradigm in nursing. So, the various conceptual models, however, define these concepts differently, link them in diverse ways, and emphasize different relationships among them. So, marami tayong mga theories na available in our nursing literature. So, you can use any of that as long as align sila or applicable sila in your study. So in this slide, I included here samples of conceptual models and theories of nursing, indicating the theories, name of model or theory, key concepts, and research example. So be guided on how the research sample used the theory to guide their research. Again, this is for your further reading. So the second major part of this lesson is about variables. So in quantitative studies, concepts are usually called variables. So when we say variable, as the name implies, it is something that varies. So weight, anxiety, and blood pressure are variables. Each varies from one person to another. In fact, most aspects of humans are variables. If everyone weigh 150 pounds, weight would not be a variable. So it would be a constant na. Okay? So it is precisely because people and conditions do vary that most research is conducted. So quantitative researchers seek to understand how or why things vary and to learn if differences in one variable are related to differences in another. So for example, lung cancer research is concerned with the lung cancer, which is a variable because not everybody has this disease. So researchers have studied factors that might be linked to lung cancer, such as cigarette smoking. So smoking is also a variable because not everyone smokes. So remember that variable is any quality of a person, group, or situation that varies or takes on different values. And that variables are the building blocks of quantitative studies. So attribute variables, it refers to the values assigned to a specific variable. Example, gender. Attributes may be assigned is male or female. Another example is agreement. So it may have the following attributes. Agreement, if you strongly agree, you agree, disagree, and strongly disagree. So the extent of your agreement, you can choose from those options. So yun yung mga attribute variables na tinatawag natin. So variable can be homogeneous or heterogeneous. So this is a degree of variability or heterogeneity of a group of people. So when an attribute is extremely varied in the group under study, it is termed as heterogeneous with respect to that variable, meaning iba-iba sila ng values na yon. If the amount of variability naman is limited, the group is homogeneous. So for example, for the variable height, a group of 2-year-old children is likely to be more homogeneous than a group of 18-year-olds, meaning iba-iba ng height yung meron tayo sa mga 18 years old since several factors are already present such as their hormones, diet, etc. Okay, next, let's talk about continuous, discrete, and categorical variables. First, we have continuous variables. So they have values along a continuum and in theory can assume an infinite numbers of values between 2 points. So a person's age, for instance, can take on values from 0 to more than 100, and the values are not restricted to whole numbers. So consider the continuous variable weight between 1 and 2 pounds. The number of values is limited, like 1.05, 1.8, 1.33, and so on. So therefore, the number of value is limitless. So it can be whole numbers, fractions, or decimals. So examples ng continuous variables natin include dosage, age, height, and many more. By contrast, a discrete variable has a finite numbers of values between any 2 points representing discrete quantities. So for example, if people were asked how many children they had, they might answer 0, 1, 2, 3, or more. So the value for number of children is discrete because a number such as 1.5 is not meaningful. Between 1 and 3, the only possible value is 2. So wala tayong mga point something or fraction. Usually whole numbers sila. So example, number of cigarettes smoked per day, number of children, number of patients per day. So yun yung ating mga discrete variables. Other variables take on a small range of values that do not represent a quantity. Blood type, for example, has 4 values: A, B, AB, and O. So variables that take on a handful of discrete, non-quantitative values are categorical variables. Okay, naka-categorize yung ating pamimilian. So, they do not represent quantity. When categorical variables take only 2 values, they are dichotomous variables. Gender, for example, is dichotomous. male and female. And then if you are asked if you have HIV, the response can either positive or negative. Hence, dichotomous. Dalawa lang yung pamimilian. Let's talk about the type of relationship, which is a bond connection between phenomena. First, we have the causal relationship or the cause and effect relationship. In discussing this, we have to take note that variables can either be independent variable or dependent variable. So many studies seek to unravel and understand causes of phenomena. For example, the question, does nursing intervention cause improvements in patient outcomes? Yung intervention ba natin yung nakapagpagaling sa pasyente? Another example, does smoking cause lung cancer? So the presumed cause is the independent variable and the presumed effect is the dependent variable. Some researchers use the term outcome variable, the variable capturing the outcome of interest, in line of dependent variable. So variability in the dependent variable is presumed to depend on variability in the independent variable. Ibig sabihin, if we want to investigate the cause and effect relationship among variables, si DV is depending only sa ating IV or independent variable. Halimbawa, researchers study the extent to which lung cancer depends on smoking. Tinitignan natin in this example if really smoking can result in lung cancer, which is the effect or our dependent variable. So this is in line pa rin with the previous slide. The IV is smoking and the DV is lung cancer. Most often, ginagamit natin yung ganitong design sa mga experimental studies to be certain about the cause and effect relationship between the variables under investigation. We are introducing an input or our treatment or intervention, which is our IV, and this is being manipulated by the researcher. And we are looking into its output, result, or the outcome, which is our dependent variable. Sa mga ganitong design, the researcher manipulates the IV. That is dahil nga sa interventions na binibigay natin or wini-withheld sa mga subjects. And then the DV is manipulated by the independent variable. So if we are interested to infer cause and effect relationship, experimental yung ginagamit nating design ng quantitative study. IV is written first before dependent variable. So on the other hand naman, we have functional relationship or associative relationship. So frequently, independent variable and dependent variable are used to indicate direction of influence rather than a causal mechanism, such as in this figure, studying the mental health of caregivers caring for spouses with Alzheimer's disease or AD. For example, the study revealed better mental health outcomes for wives or females than husbands or males. So the researcher might be unwilling to conclude that caregivers' mental health was caused by gender. If that is the case, then we are only interested in the direction of influence of one variable on another variable. And this is an example of a non-experimental research or a correlational study. So remember, we do not infer a cause and effect connection sa mga ganitong design. Anyway, we'll learn more of this when we get to the different types of quantitative research design. Okay, study concepts need to be defined and explicated, and dictionary definitions are seldom adequate. So two types of definitions are of particular relevance in writing your research paper. So you have your conceptual definition and operational definition. So ito yung na-discuss ko na rin kanina sa under concepts, no? So concepts, sabi natin, are abstractions of observable phenomena, and researchers' worldviews shapes how those concepts are defined. So conceptual definition, ulitin ko na lang din, so presents the abstract or theoretical meaning of the concepts being studied. So the classic example is the concept of caring. So Morse and colleagues 1990 scrutinized the works of numerous writers to determine how caring was defined and identified five different classes of conceptual definition as a human trait, a moral imperative, an affect, an interpersonal relationship, and a therapeutic intervention. So researchers undertaking studies concerned with caring need to make clear which conceptual definition they have adopted, both to themselves and to their readers. Remember, nilalagay natin yung reference natin for your conceptual definition. Again, cite properly all the borrowed ideas or information. So just like this one. So on the other hand, it is necessary that quantitative researchers must also indicate how the variables will be observed and measured. So an operational definition of a concept specifies the operations that the researchers must perform to measure it. So operational definitions should be congruent with the conceptual definitions. So variables differ in the ease with which they can be operationalized. So the variable weight, for example, is easy to define and measure. We might operationally define weight as the amount of object weighs to the nearest full pound. This definition designates that weight will be measured using one system, which is pounds, rather than another, grams. So we could also specify that weight will be measured using a spring scale with participants fully undressed after 10 hours of fasting. So this operational definition clearly indicates what we mean by the variable weight. Now, few variables are operationalized as easily as weight. So most variables can be measured in different ways, and researchers must choose the one that best captures the variables as they conceptualize them. So for example, si anxiety, which can be defined in terms of both physiologic and psychological functioning. So for researchers, choosing to emphasize physiologic aspects, the operational definition might involve a physiologic measure such as the Palmar Sweat Index. If researchers conceptualize anxiety as a psychological state, the operational definition might involve a paper and pencil measure such as the State Anxiety Scale. So pipiliin nyo yung pinaka-accurate or aligned in your study. So variables that do not require operational definition, examples are age, sex. Okay, so yun yung mga variables na hindi mo na kailangang i-operationally define. So again, align dapat si conceptual definition and si operational definition. Height and weight, nilalagay lang natin kung anong instrument to measure and unit of measurement na gagamitin. Okay, that is also a variable that do not require substantial operational definition. So investigators, responsibility ang i-operationalize ang term. You have to justify the operational definition in terms of the purpose of the study, and it must be completed enough to allow another investigator to replicate the study accurately. Another example, itong nasa ilalim. So, postpartum depression, ito yung kanyang conceptual definition. A cognitive impairment conceptually defined as a mother, okay, and then yung kanyang definition. So, again, align natin sa operational definition. So, how are you going to measure the postpartum depression? So, this one, we use postpartum depression screening scale. So, ito yung mag-operationalize sa concept na to. Okay? So, align dapat si conceptual with the operational definition. Conceptual definition, the definition based on the concepts of your study. Operational definition, how are you going to measure or observe the that concept? Okay? That term na you have. So again, conceptual definition, then you have to cite your reference or author, and is based on theory. Operational definition naman, how you're going to measure the variable using an instrument or questionnaire. It must be observable. And you have to name the instrument or the questionnaire that you will be using. Okay? So I hope clear ito because in writing your research paper, it is indicated. No, you will have to write your conceptual definitions and operational definitions for those terms. So, another example, ito siya. Conceptual definition, ito yung health. So, for example, ang kinuha natin conceptual definition na align in your study is from World Health Organization 2008 definition. It is a state of complete physical, mental, and social well-being and not merely the absence of disease or infirmity. Ang operational definition naman na align sa study ko, for example, still sa health pa rin, it refers to the state of being categorized as to normal, underweight, overweight, and obese according to BMI of the individual. So, ibig sabihin, this is how I'm going to measure the health of an individual. So let's have a short activity. So identify the IV, the independent variable, and DV, or the dependent variable, and then formulate the conceptual framework of the study. So number one, example, the effects of sleep deprivation on wound healing among patients with diabetic foot. Second, the relationship between health status and the physical and psychological abuse among adolescents. And then third, the association of sleep, environment, and social support in the quality of life of patients with depression. So while answering, you can pause the video now and then play again once you are done to check the correct answer. Okay, so let's see the correct answer. For number one, the effects of sleep deprivation on wound healing among patients with diabetic foot. So the independent variable is sleep deprivation, and the dependent variable is wound healing. So for our conceptual framework, so IV is on the left side, sleep deprivation, and on the right side is wound healing, which is our dependent variable. Example number two, the relationship between health status and the physical and psychological abuse among adolescents. So the IV is physical and psychological abuse, and the dependent variable is health status. So on the left side, we have here the independent variables. So dalawa sila. And then on the right side, you have one, si health status. And then example number three, association of sleep, environment, and social support in the quality of life of patients with depression. So the IV is sleep environment, and social support. So tatlo sila. And we have one DV, which is quality of life. So the conceptual framework is this one. So we have three IVs and one DV. So that is for the variables. So the last major part of this topic is about research hypothesis. So let us have the different definitions of research hypothesis. So Niswayadomi of 2008 defined research hypothesis. So in scientific research, hypotheses are intelligent guesses that assist the researcher in seeking the situation to a problem. According kay Kerlinger naman ng 1986, hypothesis is a conjectural statement of the relation between two or more variables. And si Paulette and Beck of 2008, statements of the researcher's expectations about relationships between study variables. So please take note that in quali, researchers do not begin with hypothesis. So usually too little is known about the topic, and in part because qualitative researchers want the inquiry to be guided by participants' viewpoints rather than their own hunches. So wala tayong hypothesis for qualitative research in the beginning. Okay? So that's because for quanti, 'di ba? At the beginning of a research study, hypothesize na tayo. We make conjectures na. Pero for qualitative, it is not the same. Okay? It is quite different. So further, hypothesis is a statement of the predicted relationship between two or more variables. So research study may have one or several hypotheses. Should always be written before the study begins and not changed after the study results are examined. So we state the researcher's conjecture in chapter 1 sa pagsusulat ng inyong paper. Sa chapter 1 pa lang, nilalagay nyo na yung inyong research hypothesis. So purposes of research hypothesis: 1, they lend objectivity to scientific investigations by pinpointing a specific part of a theory to be tested. Second, theoretical propositions can be tested in the real world. And then number 3, it provides reader and researchers expectations about the study before data collection. So let's talk about the different characteristics of testable hypothesis. So testable hypothesis state that expected relationship between the independent variable and the dependent variable within a population. Example number 1, si Moore and co-researchers of 2009 tested patency time in long-term indwelling urethral catheters among patients in 3 groups: those receiving standard care, a normal saline washout, or an acidic washout solution. So the researchers hypothesized that time to first catheter change would be longest among patients who had the acidic washout solution. So in this example, the population is patients with long-term indwelling urethral catheters. The independent variable is the methods of managing blockages, and the dependent variable is the length of time elapsed until first catheter change. So the hypothesis predicts that these two variables are related within the population. Longer catheter life was expected for those receiving the acidic washout solution. Second, when researchers' hypotheses do not make a relational statement, it cannot be tested. Okay, so kung wala tayong relational statement, then it cannot be tested. So, for example, pregnant women is who receive prenatal instruction regarding postpartum experience are not likely to experience postpartum depression. So it is incorrect because um, this statement expresses no anticipated relationship. And then there's only one variable, which is postpartum depression. So in hypothesis testing, again, a relationship requires at least two variables. To correct this, pregnant women who receive prenatal instruction, which is our IV, are not to receive the treatment, which is a prenatal instruction, are less likely to experience postpartum depression, which is now our DV, than those with no prenatal instruction. Okay? So here the dependent variable is the women's depression. Okay, and the independent variable is the receipt ver- versus the non-receipt of prenatal instruction. So the relational aspect of the prediction is embodied in the phrase less than. Okay, so less than. If a hypothesis lacks a phrase such as relational aspect of the prediction, such as more than, less than, greater than, different from, related to, associate, associated with, or something similar. So yun yung mga ginagamit natin to infer relational statement. It is probably not amenable to testing in a quantitative study. So to test this revised hypothesis, we could ask two groups of women with different prenatal instruction experiences to respond to the question on depression and then compare the groups' responses. So the absolute degree of depression of either group would not be an issue. Now, what are the sources of hypotheses? Hypotheses are not wild guesses or shots in the dark. So researchers should be able to state the source or rationale for each hypothesis that comes from. Theory, um, we have previous research or personal experience. So ito yung mga sources of rationale for hypothesis. No? So you have your theory, previous research, or personal experience, meaning we have a basis to come up with our hypothesis. So let's start. Number one, theoretical or conceptual framework. So this is the most important source of hypothesis. So this process of hypothesis development is called deductive reasoning hypothesis. So we deduce from general to deduct specific. So you deduce from general to deduct specific. So the propositional statement is isolated from the study framework. Example, in Maslow's hierarchy of needs, we can isolate the test proposition. Example, in Maslow's hierarchy of needs, we can isolate and test proposition. For example, the safety needs, it takes precedence over self-esteem. So then, asking group of patients to rate a list of nursing actions, and then we could determine if if the rated actions that concerns patient safety higher than self-esteem. Again, we refer to our theoretical framework, then isolate the applicable propositional statement and use as our hypothesis. So that's number one, theoretical or conceptual framework. Another source of a research hypothesis is from our personal experience or observations. So a generalization based on observations that is from specific to general. It is known as inductive hypothesis. So even when a study is based in empirical generalization or from experience. A review of related literature should be conducted, then attempt to find a theoretical explanation for the observed phenomenon. For example, observation. Ito yung na-observe mo, no? As the time for discharge draws near for psychiatric patients, the anxiety levels of psychiatric patient increase. So the conjecture is from specific to general. So paano mo ngayon ilalagay into hypothesis yung na-observe mo? So this is an example of that hypothesis. So the anxiety levels of psychiatric patient are higher immediately before discharge than they are 3 days before discharge. Okay, so that is how you put into hypothesis yung na-observe mo. So that is again the another source for hypothesis, which is based on your experience or observation. So ito lang yung wordings of hypothesis. So in general, hypothesis should be worded in present tense. Researchers make predictions about relationships that exist in the population. So nagpe-predict tayo about the relationships when we write the hypothesis. And it can be stated in various ways as long as researcher specifies or implies the relationships to be tested. Okay, so let's now talk about the classification of hypotheses. First, we have simple versus complex. So for simple hypothesis, we have a bivariate here. Okay, pag simple, bivariate lang tayo. It expresses an expected relationship between one IV and one DV. So bivariate because one IV and the other one is DV. So dalawang variables lang. Isang IV, isang DV. For example, birth weight is lower among infants of alcoholic mothers than among infants of non-alcoholic mother. So the great in here, the dependent variable is birth weight and our independent variable is alcoholic mothers or the non-alcoholic mother. Okay, so meaning tinitignan natin what would be the result of being an alcoholic to the infant's birth weight. Okay, so isang dependent variable and isang independent variable. Next, number 2, the greater degree of sleep deprivation, the higher anxiety level of ICU patients. Okay, so again, we have one independent variable, which is sleep deprivation, and then the dependent variable is anxiety level. And then the patient is, I mean, the population here under study is the ICU patients. Okay, so this is an example of a simple hypothesis. We only have one variable, one independent variable and one dependent variable. So, bivariate lang siya. Tig-isa lang. Next, you have complex hypothesis or multivariate. So, this is the prediction of relationship between two or more independent variable and two or more dependent variable. So, this time, um, more than two variables na, no? Kasi kanina, in simple, bivariate lang. Tig-isa lang na independent at isang dependent variable. This time, either dalawang dependent or dalawang independent variable. So, meaning more than two na kapag complex hypothesis. Multivariate na tayo. So, we better to divide complex hypothesis into two or more simple hypotheses para mas madalian tayo. Note, hypothesis is either supported totally or it is not supported. Again, hypothesis is either supported totally or it is not supported. So we have a term lang na interaction effect. It concerns the actions of two variables in conjunction with each other. That is their interaction with one another. So tawag doon interaction effect. So examples of complex hypotheses or multivariate. Number one, daily weight loss is greater for adults who follow a reduced calorie diet and exercise than for those who do not follow a reduced calorie diet and do not exercise daily. So in this example, we only have one dependent variable, pero we have two independent variables, which include calorie diet and exercise. So again, two IVs and one DV. And then example number two, among breast cancer survivors, emotional well-being is influenced by the women's self-esteem, their resourcefulness, and their degree of social support. So the respondents here are adults. And then this time, still we have two independent variables, which is, we have this time, tatlo na pala, no? Again, the example, among breast cancer survivors, emotional well-being is influenced by the women's self-esteem, their resourcefulness, and their degree of social support. So we have three IVs here: self-esteem, resourcefulness, and social support. And we have one DV, which is emotional well-being. So ibig sabihin, again, complex hypothesis. This is multivariate, meaning multiple variables tayo, usually more than two. Okay, another classification of hypothesis as to either research versus null hypothesis. Pag sinabing research hypothesis or H sub 1 or H1, it is also termed as alternative hypothesis, scientific, substantive, or theoretical hypothesis. So it states the expected relationship between variables. Kung ano yung ina-expect mo na as a researcher na relationship among your variables, that is what we call as research hypothesis. So readers can determine exactly what the researcher expects to find when analyzing data. So for example, the prediction is that variables A and B are related. And another example, there is a relationship between sleep and wound healing. So ito yung iyong hypothesis as a researcher. No, the expected relationship or outcome. And then you have, on the other hand, you have the null hypothesis or H sub 0. So statistical, it is also termed as statistical hypothesis. So it predicts that no relationship exists between variables, and it is a null hypothesis that is subjected to statistical analysis. So we have logic of statistical inference. So they require hypotheses be expressed such that no relationship is expected. So for example natin, the only other possible outcome is that variables A and B are not related. So ito yung mga laging negative na hypothesis na sinusulat natin. Another one, there is no relationship between sleep and wound healing. So that is null hypothesis. Laging negative or laging no relationship or no difference kapag ka sa null hypothesis. And then another classification of hypothesis as either directional and non-directional. So when we say non-directional hypothesis, it does not stipulate the direction of the relationship. So researcher merely predicts that a relationship exists, but no direction is indicated. So appropriate tong gamitin, si non-directional, when there is no theory or related research. when findings of prior studies are contradictory, or when researchers' own experience leads to ambivalence. So take note that some argue that non-directional hypothesis is more preferred since it connotes degree of impartiality or you are not biased as a researcher kapag ka ginagamit to. So for example, the prediction that a patient's age and the risk of falling are related. So paano yung non-directional hypothesis na yon? So letter A, there is a relationship between the age of a patient and the risk of falling. Another example, letter B, older patients differ from younger ones with respect to the risk of falling. So itong dalawang hypothesis na to, are examples, state the prediction that a patient's age and risk of falling are related, but they do not stipulate whether the researcher thinks that older patients or younger ones are at greater risk. So sinasabi lang yung kanilang relation, pero we do not stipulate the direction of the hypothesis. And then, pag sinabi namang directional hypothesis, it is one that specifies not only the existence of the relationship, but also the expected direction of the relationship between variables. And this one, it might lead to bias. So advantages, the researcher's expectation is clear. It allows more precise testing of theoretical propositions and allow the use of one-tailed statistical test. Ang example natin dito, ito yung in line with the previous example. So number one, older patients are more at risk of experiencing a fall than younger patients. Okay, so directional. Sinasabi na natin na may relationship sila and you're indicating a direction. Okay, na yung older patients are at higher risk of experiencing fall compared to younger ones. Second, the risk of falling increases with the age of patient. And then lastly, younger patients tend to be less at risk of a fall than older patients. So the given examples are directional because there is an explicit prediction that older patients are at greater risk of falling than younger ones. Again, we prefer directional hypotheses when there is a reasonable basis for them because they clarify the study's framework and demonstrate that researchers have thought critically about the phenomena under study. So directional hypotheses may also permit a more sensitive statistical test through the use of one-tailed tests. So additionally, hypotheses derived from a theory are almost always directional. So directional hypothesis should contain predictive term like um, less, greater, decrease in, or negative correlation. So for example, the research question is there a difference in readiness to learn about people preoperative teachings between preoperative patients who have anxiety levels compared with preoperative patients who do not have anxiety levels. So for the hypothesis, readiness to learn about pre-op teaching is less. So we use the term less among pre-op patients who have anxiety levels compared with pre-op patients who do not have anxiety levels. So the direction is indicated and the predicted term is less. So additional notes lang to, no? Some researchers express hypothesis in null form. It is generally more desirable to state the research expectations, according to Barty 1997 and Kerlinger 1986. So, mas okay sa kanila yung researchers' expectations daw. According to Pollitt and Beck, 2008, they prefer directional hypothesis naman when there is reasonable basis because it clarifies the studies framework. Ito yung nasabi na natin kanina. And then if you formulate hypothesis, sabi, avoid stating them in null form because it gives an amateurish impression. Pero depending on your university format, kung ano yung fina-follow ninyo in stating your hypothesis. So these are the criteria, hypothesis criteria sa pagsusulat, no? Again, criteria in writing your hypothesis. So number one, the hypothesis must be written in a declarative sentence. So hindi pa tanong. So instead, we use declarative sentence because hypothesis present to an answer to the question. Number two, be written in present tense because they are tested in present. So not in future tense. So there is a positive relation between the number of times children have been hospitalized and their fear of hospitalization. So this is the example written in present tense. Number three, it must contain the population. Example, middle age 40 to 55 years old women. So this is our population who are about to undergo a hysterectomy. So identify them specifically as it is in the problems. Ito, pang ano to, pang lima. Edit lang to, no? Din nailagay dito. So number four, contain variables. So another criteria, the hypothesis must contain the variable. It may reflect instrument to be used if ever. So a scientific hypothesis contain at least two variables. Sabi nga natin, either one independent and one dependent, which are linked in the hypothesis. So at least may dalawa tayong variables. And we indicate those variables kapag tayo ay magsusulat ng ating hypothesis statement. So ito yung number 5. So ito yun ano. So typo error lang to. So number 5, reflect the problem statement or purpose statement or research question. So congruency is a must. So kung ano yung nasa problem statement, dapat align siya with your hypothesis. So hindi nababago yung terms, kung ano yung terms na ginagamit, it should be consistent. Okay? Congruent siya. For example, the problem statement is there a change in the anxiety levels of preoperative patients after listening to relaxation tape? So for the hypothesis, so there is a change in the anxiety level of pre-op patients after listening to relaxation state. Declarative sentence in present form. It contains the variables and then it has the population, pre-op patients. Okay? So again, ito yung dalawang variables natin. This is our population written in declarative sentence. Align siya sa ating problem statement. Okay, and then naka-present tense siya. Another example, is there a correlation between IQ and academic performance of students? So hypothesis natin, there is no correlation between IQ and academic performances of students. So the dependent variable is academic performance, independent is IQ, and this one is a simple hypothesis and naka-null hypothesis tayo kasi no correlation yung nakalagay. And then tama kasi present tense, naka-declarative form tayo, and then the population is students, and we have here the variables. Yung kanina, ito pala kanina, no? It is a non-directional example of a non-directional hypothesis. Tapos, simple siya kasi isa lang din yung ating IV and DV variable. And this is a researcher's hypothesis, or the alternative hypothesis na tinatawag. Okay, and the number six criteria, empirically testable dapat. Okay, yung iyong hypothesis. A hypothesis that cannot be empirically tested has no scientific merit. So for example, nurses are better healthcare providers than physicians. Itong better na to is a value, and this one, it cannot be measured. So to correct this one, ito dapat. Nurses spend more time. Time could be measured. So teaching their clients about preventive healthcare practices than physician does. So hypotheses are formally tested through statistical procedures. So researchers seek hypotheses have high probability of being correct using statistics. However, hypotheses are never proved through hypothesis testing, rather they are accepted or supported. So findings are always tentative. Certainly, if the same results are replicated in numerous studies, then greater confidence can be placed in the conclusions. Hypotheses come to be increasingly supported with mounting evidence. Remember, neither theories nor hypotheses are proof. If research hypothesis is supported, theory which the hypothesis was derived is also supported. On the other hand, if research hypothesis is not supported, theory is also not supported. And that's the end of my presentation. So thank you for taking time to listen to our lesson today. If you have any questions, please take note of them and raise them on our next synchronous meeting. So again, thank you and God bless.